My name is Ira Sansolo. I live in Columbia, South Carolina. I am retired. I have 2 children, a daughter age 33, a daughter age 30. I'm married to my wife for the last 15 years. I have had urinary incontinence for roughly 10 to 12 years. Started a long time ago. You can just about imagine a man at 65 years old all of a sudden wearing adult diapers at night so he doesn't wet the bed, and having to run to every restroom you could find, sometimes making it, sometimes not making it. And when we would travel, I'd have to gauge out where all the bathrooms were between home and where we were going. It was awful. It was absolutely awful and so humiliating, constantly.
I saw Ira for severe overactive bladder, so urgency, frequency, and urinary incontinence. This was so severe that it was really limiting his social interactions, keeping him from being able to go to the store or go on road trips. What we did is we first evaluated his bladder with this advanced bladder function testing called urodynamics, and made sure the problem really did lie with the bladder. In men, we have to think about, is it the prostate, is it the bladder, is it something else? And so with Ira, we narrowed it down to it being a bladder issue. We then went through the options for overactive bladder. We tried several medications and really didn't get an ideal response, no matter how strict he was with himself and limiting his caffeine and fluid intake and taking his medications. It just really wasn't making a big enough difference. When we talked about the options, Ira decided that sacral neuromodulation sounded like the best option for him. That's a device that's similar to a pacemaker, but for the bladder. And so it can help regulate an overactive bladder. In his case, he had very severe urgency frequency that was really limiting what he could do with his life, his social interactions, even going to the store. We used this device to regulate his bladder, and he had a remarkable response, and he's really said it changed his life.
I was made to feel very well in Dr. Rueb's office. She's a phenomenal doctor. She's very kind-hearted. She's very intelligent, and she really has a great manner about herself. Her whole staff is exactly the same way. They only care about the patient. Her nurses and her staff did everything they could to make me feel comfortable. They understood what I was going through, and they explained the whole procedure, start to finish, and they've just been great. Every one of them has been great.
The benefit that my field brings is that we're really subspecialists within urology, that I focus on bladder function and pelvic health. We have the ability to really do those advanced testing and understand the dynamic between the bladder and the prostate, for instance, or understand how that pelvic health is affecting the bladder. I encourage patients to really bring it to our attention. One thing about overactive bladder is that many patients just suffer in silence. They just assume that this is normal and they never bring it up. So first step is bring it up and talk about it. And then, there's several steps we have to take. There's things that the patients need to do for themselves to really help their bladder work to its best ability. And then there's things that we can do to help that bladder. Some of that is medications, and some of that is these more advanced technologies.
I traveled to Ohio 3 times. I traveled to Florida 1 time. And during all those trips, I may have had to stop once. Whereas before that, I would have to stop 5 and 6 times. And at night, I can just go to bed in regular pajamas and not have to worry about the underwear that you have to wear. That in itself has been a huge, huge change of life for me. And it's changed the dynamics of my family very, very much, because they know that I'm happier this way. And that's a really big thing in a family dynamic, is you want everybody to be happy. And in our household, we're extremely close. And my family knew that if something happened, how bad I was going to feel about it. And now we don't worry about those things anymore.